Hi everybody, welcome to a brand new episode of Perspectives Podcast. Now you're tuning in because you're super curious to learn about your pet's well-being and health. And our goal for this podcast is to introduce you to thinkers, leaders, experts who can inspire us with new perspectives to help our pets, dogs and cats, live a longer and better life. Now today, we have a very special guest. Her name is Chik, a certified pet physiotherapist who is also the founder of Paws Rehab, who specializes in canine rehabilitation and physiotherapy. But before we dive in, I just want to let all of you know that there will be a live demo that's happening later in the interview. So feel free to please tune in to our videos so that you can watch our live demo. Now, back to the podcast. First of all, Sydney, thank you so much for taking the time out to talk to us today. I want to jump into a couple of questions that are very important. So I read that there was a research that was done in the UK that were investigating pain for pets. And it was also noted that 70% of the dogs that were sent in had some form of pain. How can a pet parent tell when their pet is in pain?
Okay, sure. So first of all, thank you for having me today, Yanteng. So to answer your questions, there are actually several ways for us to detect a pet which is in pain. So first of all, you will see them starting to limp or they will have lameness in walking. So that will be the first sign that we know if the dog is in pain. And then they will start to have difficulty, either getting up with difficulty or walking with difficulty. And some dogs might have problem going upstairs, whereby last time they used to be able to do that, but now they would have a bit of problem going up and down the staircase. In some cases, dogs would be pain when you are touching them. So where the pain is, when you are touching them, they would shout and scream in pain. That would also be one of the ways to detect.
Yeah.
And also they are panting more than usual. So normally your dog doesn't pant, and suddenly out of a sudden you see them panting a lot. It could be a sign of pain too. Last one would be unusual licking of a painful site. So if they are pain on the knee, they will actually lick the knee area a lot more than usual.
Right.
And there's nothing underlying going wrong, no skin issue, but it's just excessive licking.
Yeah. Wow, okay. So you've run your rehab center since 2012 and I know you're super experienced. You've worked with thousands of dogs, right? Can you share with us some like early red flags for pets with physical issues? Maybe let's start with dogs or large breed dogs.
Okay, so basically those dogs and cats presented to me in my clinic, they already have some sort of deformities, or I would say lameness. As a whole picture, larger breed dogs would have problem with their hips, so they tend to have problems with hip dysplasia. And for smaller dogs, they would have problems with their kneecaps, which is what we call patella luxation.
Right, is that the one where the kneecap is out of position?
Yes, so when your kneecap is supposedly to be inside the groove, but with patella luxation, the kneecap starts floating.
Is it painful when that happens?
So patella luxation generally is not painful, unless when you have a patella problem and then the dog accidentally injure themselves further and they injure their cruciate ligament. That's when the pain is coming from.
So when they get sent into your center, what do you help them? How do you help them?
So basically, I would see how they walk first. After looking at their gait, I could easily identify whether the problem is coming from the front limb or the back limbs. And then I'll dive down into my physical examination to check and pinpoint where the problem is coming from.
Right.
So after that, we will actually discuss with the owners and discuss a plan to work out, and then see which one or which treatment is actually more suitable for the pet.
Okay, I want to touch on pet parent a little bit. But back to our original question, what about physiotherapy for cats? Is it also normal?
Yes.
Common?
Yes. Yeah. So cats will require physiotherapy as well, because they also have problems like arthritis or spinal problems, spinal compression, IVDD, intervertebral disc disease.
Right.
Yes,
that is
also happen in cats. So it's more of a problem when the spine is having some issues.
IVDD. Okay, interesting. So physiotherapy for cats, you're also saying that it's quite common and they have slightly different issues compared to dogs.
Very slight difference, but generally the under the whole umbrella is pretty much the same. The only thing different is when you are treating a cat is actually more difficult.
Oh,
Because cats, they live in their own world. They're not as
they're
easygoing.
independent
Yeah.
and they're okay.
Yeah, so they're not as easygoing as a dog.
Right.
Because dog, they do respond to treats, but cats, when they're stressed, they just blocked out and they don't
Hide
eat.
in their corner.
Yeah, so some cats are very ferocious. They will bite, they will scratch. So it makes our job very difficult.
Yeah. Then how do you come up with a suitable treatment plan for your pet patients?
So it also depends on what I assessed.
Yeah.
So after I assess, I will actually see which one is more suitable. For example, a dog coming in, which is very old,
Yeah.
and they could have problem underlying with their heart and lungs. So we know that hydrotherapy is out of the question because we don't want to have any problems appearing when they
With
are swimming.
breathing or okay.
Yeah, so we will go to a safer approach, which is the underwater treadmill. So
Right.
in the underwater treadmill, they're actually more calm because they can actually touch the floor.
Right. As opposed to hydrotherapy, which is
Completely floated. So underwater treadmill and hydrotherapy, the only difference is the cat or the dog can touch the floor and they feel more secure.
right.
And the speed of the treadmill is actually
adjustable.
adjustable,
Okay,
and the
that's
height of
good.
the water is also adjustable. So it's more safe.
Yeah, I've seen so many videos and chats about underwater treadmill.
Yeah.
Is it also suitable for dogs that are larger breeds or smaller breeds
Yeah.
across the breeds?
Yeah, so the reason why I actually get an underwater treadmill is because there are actually a lot of limitation for me if the pet is too big. So for example, my swimming pool, it's just the size of maybe a maximum a golden retriever could be swimming inside.
Okay.
So if not, I'll need a very large pool.
Yeah.
So space is a problem. So it's very space consuming. So on the other hand, the underwater treadmill is actually good. I can cater to all different sizes of dogs,
Okay.
be it a tall Great Dane or a small Pomeranian. They are actually a very large possibility that I can fit. So that's why the underwater treadmill is good, and the water of the treadmill can
Yeah.
be adjusted according to your height.
Oh.
And also, a lot of dogs, when they are obese, it's very hard for them to actually do land exercises.
Oh, I see. Yes.
Yeah, because of the stress of the
On the
weight
limbs,
on
yeah.
the joints.
Oh,
So underwater is also very good for us to lift the weight up, so that they can exercise in a weight-free environment.
Wow, okay. So I think you mentioned just now about assessing a suitable treatment, right? I have a question around like also handling pet parents. So I know that like the parents themselves also kind of mirror how the pet behave. How do you manage pet parents' expectations as well?
Well, expectations is something that I always play on the safe side. So of course, when your kid or your dog is injured, you would want them to recover to 100%.
Of course.
But at most of the time, if your dog have been pain for a long time, the muscles are atrophied, and it takes a while, or I would rather say we could actually rehab them to maybe 90%.
90%.
Okay, but it's always not 100%.
Yeah.
So, for example, if your dog have undergone a surgery, be it a knee or hip or a front limb surgery, the leg will never be the same again. It will always tend to have a bit of difference
Correct, yeah.
in terms of the length, in terms of the structure. So I always tell pet parents that try not to put your hope too high that the dog could be 100% as good as before. Yeah, so that's the main thing I need the pet parents to understand.
Yeah. Were there cases where like pet parents bring their pet in and then you realize that they're not a good fit for physiotherapy?
Yes, unfortunately, yes.
What happened?
Most of the cases where they are old.
When they're old, like how old?
Large breed, I would say above 13 years old.
13?
Yeah, and as a small breed, I would think about 16 onwards would be very, very old already. So these kind of cases, usually when they come in, they would be bedridden,
Yeah.
or they couldn't walk at all. And then you start to see them having pressure sores around the joints.
Right.
So these kind of cases, usually what I would tell the owner is perhaps maybe making a wheelchair for them would be a good idea.
Yeah.
But, well, to force them through physical therapy
It's
would
hard.
be hard. Yeah. So these kind of cases, what we can do is pain management to stretch and massage them and make them feel comfortable. And I will also tell the owners to give them as much tender loving care until the end.
I think that's the more important thing that pet parents can do for their pets as well. So in one of my research, it also shows that 65% of cats and 60% of dogs are actually overweight. What is happening?
That would be very, very much related to the lifestyle of the owners. And also some dogs, to be fair, when they are neutered, or I would say castrated, they have the hormonal change that is happening.
Yeah.
So they would gain a lot of weight after the procedure.
Okay.
So keeping that aside, if we are talking about a normal dog, it all depends on how much the owner feed, which I think in Malaysia, what's happening is overfeeding and also sedentary lifestyle. So basically the cat and dog is just lying around the whole day, doing nothing.
Yeah.
Yeah. So that's why, and it's the main reason of the contribution of the weight gain.
When you say overfeeding, it's like you're saying like how many times a day, the weightage of the food,
I think it's more of the portion of the food they are giving.
portion of the food.
And the amount of treat sometimes is unlimited. So as long as the dog just stare at the owner and ask for the treat, they will just give.
I mean, that's what they're very good at doing.
Yeah.
And also very good at doing absolutely nothing at home and looking super cute.
Yes.
What advice do you have, for example, for me as a pet parent? Sometimes I come home after a long day at work. I'm also, like, to be honest, quite lazy and tired to bring them out for like walks and stuff, right? What is your advice for pet parents to make sure that they are not just like lazing around and doing nothing at home?
Basically, we just need pet parents to spare maybe about 30 minutes.
30 minutes a day. Okay.
So go out for walks. So that walk would take about 15 to 20 minutes.
Yeah.
And then back to home, you can do some simple exercises.
Yeah.
Which includes sit to stand. Just basically ask the dog to sit and stand repetitively.
But with treats though.
Yes, with treats, but a small amount.
Okay.
And sit to stand for maybe 10 times. And then other exercises would be just standing the front legs on a platform.
Yeah.
Which is higher than the back legs, but not too high, about 45 degrees.
Standing on the front leg that is higher than the back leg.
Correct.
Okay.
Yeah. So then that actually helps to put more weight on the back legs.
Oh,
so that
to
they can
strengthen
strengthen the back legs.
I see.
Because most of the cases I have, they are having problem with the hind legs rather than the front.
I see.
Yeah. So then some basic reverse walking, which is also very effective to strengthen the hamstring, which is one of the muscle that is very, very not developed in most of the dogs. Yeah.
Okay, so some simple exercises would be sit to stand about 10 times. Of course, 30 minutes walk a day would be good. And also, you were saying the reverse walking as well.
Yes.
These are some simple stuff that we can do at home.
Yeah.
Okay. I have another question that pet parents always asking. What is the right way to actually carry your dog or cat?
Yes, this question is very, very good. So a lot of times I get pet parents when they come to my center, I see how they carry their dogs. Sometimes it's totally wrong.
Oh,
so it's good that you ask this question so we can actually
I feel like I'm also
demonstrate.
guilty of this.
So we have a dog mannequin over here. So basically, you notice the spine of the dog is not as the same as a human. So human is actually vertical, upright, but dog is actually horizontal.
Yep.
So a lot of times what I see pet parents do is when they have the dog coming forward,
Facing them.
they actually carry them like a kid,
Yeah.
like a children. So they carry upwards,
Yeah.
like that.
That's the
So-
intuitive way of just like carrying like that.
Correct.
But it's not correct.
Correct, it's not correct.
Okay.
It's very, very bad for the shoulder joints because when you're carrying them up, of course,
Yeah.
this mannequin is actually quite stiff.
Yeah.
But as for a dog, you're actually stressing a lot on the shoulders. Okay? And at the same time, the spine is actually left unsupported. Right? So the good way to carry them is always keeping their spine straight
Okay.
and then carrying them under the chest and another hand under the tummy.
Oh.
Okay? So this is how you should carry them. Make sure their spine is always
Straight.
in horizontal position.
Horizontal position.
So then a small dog, you can actually just carry them up and actually just put them at the side.
Yeah.
So when you're doing this, you put your thumb
Yeah.
and the finger
In between.
in
the...
between.
Ah.
Yeah. So then after that, you can just put them beside your chest.
Yeah.
And use your elbow to actually support the back.
I think it's probably easier with smaller breeds. Like
Yes,
if they're about,
definitely.
let's say 8 to 10 kg, it's quite heavy to carry with one hand, right?
Correct. So when you have a large breed, so basically how we carry them is you have to support the back and the front in this way and carry them up.
Oh.
Yeah, so this is how you carry a large breed.
Right.
Yeah. So same thing, make sure their spine is in a horizontal position at all time. Yeah, so this is how you should carry a large breed. So it depends on how strong you are. If the dog is about 40 kilos, I don't think one person can
Cannot,
be able to do
yeah.
that. So
If it's 40 kilos, then how do you
you
carry
need
the
two
dog?
person or a stretcher.
A stretcher to
Yes.
carry the dog.
Yes.
Is that common in in Malaysia?
So if you have a dog that is not moving, that's probably one of the option to carry the dogs. If not, then we will normally ask the owners to have a towel, a very
Okay.
big towel,
Yeah.
and put the dog there and carry them instead of two-man handling.
I see.
Yeah.
Yeah, okay. So it's really important because we start by carrying them wrongly when they're young. They're going to start to develop all these like shoulders and
Problems,
like, joints
yes.
issues that you mentioned,
Yes.
right?
I have one case that corgi, which is 18 kilo.
Oh my god.
Can you imagine?
Huge.
So, so what happened was the son didn't know how to carry the dog.
Yeah.
And then he carried the dog like that.
Okay.
And then
Oh
since
my
then,
God.
the dog has got pain on the shoulders, which it took us about 2 months to fix that shoulder.
Wow.
Yeah. So because that dog is too heavy
Yeah.
for you to
Carry
carry like that.
Yeah, because
Yeah.
of the weight and the pressure.
Correct.
Right. Okay. So yeah, definitely learn something new. And same way for applies for cat, right?
Yes,
Yeah.
it's actually the same.
So yeah, make sure that we carry our cats and dogs the right way.
Yep.
So I also want to learn some simple techniques that we can implement at home because I think you mentioned just now even like physical therapy can start from being at home doing all the simple movements, right? Can you share with us a simple technique on how to help our cat and dog do stretching?
Yeah, sure. We will do the demonstration on the cat.
Yeah.
Her name is Ate, and let's learn how to do the stretching. So basically, there are 3 joints that you have to take care of.
Okay.
This is the ankle, which is a hock joint in medical term. This is the knee, which is stifle, and this is the hip. So basically,
Okay.
what you want to do is firstly bend all the joints in close together, and then extend it all the way back.
Okay.
Right. So keep in mind that when you are doing the extension, you're actually not pulling from the ankle,
Yeah.
but you're actually pushing from the knee.
How much force are you actually putting in here?
Right.
'Cause-
So the force depends on the dog's tolerance.
Okay.
So if the dog can go all the way back, you can actually achieve about 180
Wow.
degrees of extension. But if some dogs, some cats, they have arthritis, which is
Yeah.
painful at the hip joint, then you cannot go so far. So the max you can do is depending on how the cats and dogs feel. Yeah. So normally what we do is about 20 repetitions of extension,
20 times
20 times.
for one side.
Correct.
Yeah.
You can stop after 20 or you can actually add some massage in later on.
Ooh.
So to do the massage on the hamstring, you go behind the muscles and use the cup shape of your hand and start circular motion
Circular motion.
over the whole muscle bulk. So usually one part of muscle, you do about 5 rounds of circular motion and then you move down to another finger.
So
then
5
again,
times each all
Yep.
the way down to the...
to the gastroc for the hamstring.
Okay.
Yeah. So you can go all the way down and then move up. So wherever you find trigger points, you can pay more attention over there. So basically how you identify trigger points is whenever you reach a part where it's a bit harder, you feel a bit tense.
Yeah.
And also when you're applying pressure, the
Right.
animal might be shivering.
Oh,
or it
that means
will
they're in
twitch.
pain when they're shivering.
That's a trigger point.
Trigger point.
Yeah.
Okay.
So trigger point does means pain when they are very acute. Acute means it's new, but when it's a chronic trigger point, it will not feel pain. But what you can feel is like a hard rock. Yeah. So basically, what you want to do is daily massages to release it, so that the dog can have a pain-free. So for the front limb, okay.
Yeah.
So this is the shoulder joint, and then the elbow and the wrist.
Three points again.
3 points, yeah. So basically, again, flex everything, and then push forward towards their face.
Ooh. Oh, towards their face.
Yes,
Okay.
from the elbow. So you notice when you're actually doing a forward stretching, everything will actually become a straight line.
It should be a straight line. That's
Yes.
the right way.
Yeah.
Okay.
So because the way of the tendons are actually interlocking each other, so when you're doing the stretching, everything will just become straight. So you don't have to pay more attention to straighten it. Yeah. So then again, simple, 20 times.
20 times.
For each limb. Okay. So it's very easy to remember. For front limb, you go towards the face.
Yeah.
Okay. And for hind limbs, you go towards the tail.
The back. Yeah.
Okay. And they should feel comfortable during the sessions. If they are actually resisting you,
Yeah.
then try not to fight with them. Basically, you just have to focus on the tricep muscles over here,
Tricep.
which is always overused because generally dogs and cats, they use about 60% of the front legs and 40% of the back legs.
60% of the front legs and 40% of the back. So mainly on their front
Correct.
limbs.
Yes.
Okay.
Even though they are normal.
Oh.
Yeah. So
didn't know that.
on top of that, a lot of dogs and cats, they have problem with their hind legs, which means they'll add on to the front
The pressure. Yeah. Oh, I see.
Yeah. So that is why they always overuse their triceps.
The triceps.
So basically, this triceps over here is where you have to focus your massaging on. So usually I just use my thumb and I go needling it. So usually what you can do is massage a few times and stretch a few times if you want to make it
Okay.
not so boring.
Yeah.
And then go again with massaging and stretching.
So now that we learn how to do like the stretching and the simple massage techniques that you shared with us, I think we can easily kind of like try that out at home. What is the difference between a physiotherapist and a chiropractor?
Okay, so this question, I'm sure a lot of owners are also confused.
Yeah, like in which cases do I go to a physiotherapy and in what case do I go to a chiropractor for pets?
Okay, let's start with what I understand about chiro. So as far as I understand, chiro does spinal manipulation and adjustments. So they will actually check your spine alignment and then adjust it accordingly. But what physio does is basically a broad range of treatment techniques that we use. So we use electrotherapy, we use hydrotherapy, we use a lot of equipments for therapeutic exercise. So we tend to identify where the problem is coming from musculoskeletally. So we check which muscles are sore, we check which joints are sore, and then we apply the different techniques. For example, electrotherapy, we use a lot of laser to reduce the pain and inflammation of the joint, and also to increase the cells regeneration. And then moving forward, if the pain is managed by laser, and also some clients will give painkillers, we then strengthen the muscles. So we do strengthening by therapeutic exercise, which includes a lot of gym balls, the peanut balls, the canalitis, the fit bone, the treadmill. And then we move on to hydrotherapy, which is swimming or underwater treadmill. So I would say it's a whole different approach.
Yeah.
Because chiro adjustment could be about 20 minutes adjustment and then the dog will be sent home. But physio, we take about 45 minutes at least to complete the whole exercise.
Wow.
Yeah, so I would say which cases to send where. So basically,
Yeah.
if your dog is having muscle loss or difficulty in walking,
Yeah.
definitely I would think physio would be helpful.
Yeah.
And for chiro adjustments, maybe if they have any issues related to the pain, basically just pain management, or if you suspect that
Yeah.
the problem is coming from the spine misalignment, you can try to go for chiro.
Is it complementary?
Yeah, it is in a way because some physio will actually work closely with the chiro
Yes.
to complement each other.
Yeah, I think it's important, for us as pet parents to understand your pet's condition, discuss with your physiotherapy or chiropractor if you have either, and then depending on your pet's condition, you can come up with like a suitable treatment plan
Correct.
for your clients, right?
Yeah, that would be the best.
Yeah. So I think we've learned quite a lot of things about pet physiotherapy. I want to learn more about you, Sydney,
Sure.
instead. Okay.
Okay.
So you've worked with thousands of dogs, and I'm sure you've had so many experience. Can you share one experience that is close to your heart?
Okay, in fact, I have one case that just came in yesterday. So this dog is actually a puppy
Okay.
when she first came,
Yeah.
and she was actually rescued by the street, suspected to be hit by the car at the
Okay.
neck area. So when she came to our center about 6 months ago, she couldn't walk at all. So all her joints are stiff, and basically she's at one spot. You know, she tries to move, but she couldn't move forward. So then, of course, prognosis is not very good because
Yeah.
all her joints are very stiff. And we tried to do a lot of stretching and massages. She would scream in pain because it's so
no.
painful. Fast forward 6 months later, she is able to run now with all her forelegs. But the thing is, we actually require the dog to come in like once a month.
Yeah.
But because of the owner's schedule, they couldn't make it.
Okay.
So they come in 3 months later. So which is yesterday when I first saw the dog. And what happened was the dog's one leg is not working anymore.
Oh no.
Yeah. So the reason behind this is because the house is too slippery. So the dog couldn't actually get up and walk as per normal. And she has been lying down there for the whole
Oh my
time.
god.
Nobody helped her to actually exercise. And what happened was the kneecap from normal, it's now grade 4.
Grade 4.
Yeah.
So how severe is that?
So grade 4 is the most severe stage of
Right.
patellar luxation, whereby the kneecap is actually outside the joint
Yeah.
at all times.
Oh no.
So even if we try to put it back, it's not possible.
It's not possible to put it back, or it keeps coming out.
It's not possible to put it back.
Oh god. Okay.
Yeah, so this dog would require obviously surgery to repair the knee. It's very sad for us because
Yeah.
we spend so much effort to rehab this dog from not able to walk to be able to run on 4 legs, and then just 3 months later the dog became like that. So it's actually very, very disappointing.
Yeah. So I think a lot of the pain that you are feeling is like seeing your client suffer and not being able to fully help, because at the end of the day, it really depends on the pet parents themselves,
Yes,
right?
yes.
Yeah. I know that you actually graduated in human physiotherapy
Yeah.
before you made a switch to further your studies in pet physiotherapy. What made you decide on that switch?
So to me, it's more satisfying treating animals compared to humans. Yeah, you can see their determination.
Yeah.
Although they are in so much pain, although they are not able to walk, but
Yeah.
they tend to understand that human is actually helping them. And then at the end of the day, seeing them from being paralyzed to be able to walk on all 4 legs, that's actually the best present or satisfaction that you can get.
Yeah, I agree. First of all, I'd like to thank you for sharing all of these new perspectives, techniques, ideas on how to help our dogs and cats start physical therapy even at home. What is one perspective that has changed your life as Sydney?
Opening pause rehab in the first place on the first day has already changed my perspective towards my life.
Oh, okay.
Because then, from day one, your whole world changed.
Yeah.
It's not so much about how much money you earn. It's a lot of times on the effort you have to put in to take care of the animals. Because we are not, of course, the best job in the world.
Why not?
It's quite tiring. It's a lot of sweat, a lot of dirt, because you get paralyzed dogs and cats that will pee and poop on you. When you get a patient with a lot of pressure sores, you can actually see their flesh and bone.
Oh no.
And
it's just very heart-wrenching to see all of
so
this.
the amount of effort we have to put in to take care of the dogs, and your life will never be the same again, because my whole photo album is all my patients. No more photos of ourselves. So it's a lot of commitment.
Yes,
to
it is.
be able to handle this industry.
Yes, I'm sure. It's probably a lifelong commitment for you to the pets around the world that comes to you, right?
Yeah, you can never say no anymore.
Yeah. And it seems like when they come to you, it's always at a very crucial stage.
Yeah, that's something that I agree. A lot of times it's actually a very bad case that a lot of other health professional couldn't manage anymore. Then they will throw the responsibility to us.
Almost like as the last resort, they just come to you.
Actually, I hope physio is not the last resort.
Correct.
It should always be the first in line, so that you don't end up with the last resort. Because a lot of times there's only limited things that we can do at the end. Because then the muscles are all tightened up, the joints are stiff. So it's actually something that we cannot reverse. But if physio was done early stage, then everything would be just perfect.
That's a very interesting new perspective that I have as a pet parent, and thank you so much for helping us understand why it's important to do pet physiotherapy for our pets, cats and dogs, obviously, because for me, I always thought that physiotherapy is for dogs and cats with serious issues, maybe after like car accident or like any severe injury. But what I've learned from today's episode is that pet physiotherapy can start right at home at a very young age, before there are any issues, right? This is to help them make sure that the quality of life is sustained throughout their life. And also, even when we don't have a lot of time at home to bring them out for walks, we can also just do simple techniques, massage, stretching, sit to stand, all of these things that you've shared with us earlier today. So thank you so much for sharing all of these. And to the listeners of the show, I highly encourage you to do your own research, because you know your pets best on their current condition. And as always, I hope that this episode gave you a new perspective.